Hi everyone, my name is Stephanie Linane and I am going to be reviewing an article today called Adolescents with Gender Dysphoria, Reflections on some Contemporary Clinical and Research Issues, written by Kenneth J. Zucker. Zucker is a clinical psychologist who specializes in gender dysphoria. He's worked in the field for many years and conducted quite a bit of research on the topic. So in this article he's going to go into 5 different specific clinical and research related issues relating back to gender dysphoria. So very briefly, those 5 issues are: 1, increased referrals to specialized gender identity clinics; 2, alterations in the sex ratio; 3, suicidality; 4, rapid onset gender dysphoria as a new developmental pathway; and 5, best practice clinical care for adolescents who may have rapid onset gender dysphoria. So diving right into these topics, our first topic was increased referrals to specialized gender identity clinics, and that name kind of speaks for itself. But there has been a drastic increase of clients who are seeking help at specialized gender identity clinics in the past few years, starting in 2004. So Zucker dives into a few different reasons that this could be. One of those could be that there's a lot more media exposure to transgender-related issues. Another reason could be that there's a lot more information out there on the internet about gender dysphoria and transgender care that's actually available, so now people have more access to that care as a result of that. Another reason is that there has been, although slow, a steady decline in the stigma around transgender-related issues and gender dysphoria. Part of that even coming from a name change in the DSM-5 itself, going from gender identity disorder to gender dysphoria, and that involved really in-depth shift of terminology that was used, and an assessment of where the distress is coming from. So that shift was very intentional to decrease the stigma around transgender related issues, and to create the clinical treatment based on confusion and social rejection instead of being transgender in and of itself. So another reason for that increase could also be that there is an increase in treatments that are available for transitioning people. So that includes hormone treatments, that includes surgeries, that includes different biomedical treatments, so a lot more access to resources for transgender people. So moving right along, the next issue that we're diving into is an alteration in the sex ratio. So in the past few years, there's been a lot higher prevalence in research of birth-assigned female transgender people than there is of birth-assigned male transgender people. So there's some different nuances to that, and different studies project different number, but in all of the studies in recent years, although there's some different studies previously, but in recent years they've all had pretty drastic differences in the male-to-female ratio, and there's been a lot higher prevalence of birth-assigned female transgender people. So there's a lot of different factors to consider with that, and Zucker actually argues that we need a lot more research done. He says that there are no good studies done on the prevalence of DSM-5 based diagnosis of gender dysphoria among adolescents, or its pre-existing label gender identity disorder. So he really suggests for clinicians to do more research. He calls on the need for more information. He also suggests that one reason is that there might be more stigma around males who are demonstrating femininity than there are for women who are demonstrating more masculine traits. So it could be in terms of just what is more culturally acceptable that is really skewing those numbers. So the next topic that Zucker addresses is suicidality. Suicide is a very real and a very sobering topic that it often comes up right alongside gender dysphoria. And for a lot of good reasons, but Zucker really addresses this from a different angle and critiques a lot of the research that has been done about suicide and gender dysphoria. He critiques these studies in large part because of the measurement strategies that they use, including self-reporting and a lot of the crude metrics of suicidality that come up in a lot of these studies. So many of these studies compare youth or people with gender dysphoria to the average population. Zucker suggests that in conducting research, we also need a comparison group to other youth who have been referred for various mental health concerns, as well as a comparison group that addresses those with no mental health concerns. So Zucker finds that although there's increased suicide ideation in those with gender dysphoria, they actually have a lot closer ratios to other adolescents who are referred to clinics for any other mental health concern. One study broke down different clinics' self-reporting suicidality rates compared to non-referred and referred youth, and the rates were extremely close for gender dysphoria youth and those who are just referred for any other mental health concern. Ultimately, Zucker concludes that we do need to continue doing research on suicide and its relation to gender dysphoria. So the fourth topic that Zucker dives into is rapid onset gender dysphoria as a new developmental pathway. So previous literature assesses two different groups, early onset dysphoria and late onset dysphoria. Late onset dysphoria is still much more common in birth-assigned males than in birth-assigned females, according to this literature. And there's a lot of literature that really breaks down these two different subgroups. However, in the last few years, we've really had a new group of adolescents rise up that appears to have no previous history of gender dysphoria in childhood or other gender nonconforming behavior. The parents' view is that the gender dysphoria appeared out of the blue and there was no prevalence of it before. So there's really been one study that has been done on rapid onset gender dysphoria done by Lippman, and he identified some different factors that were frequently associated with rapid onset gender dysphoria. This includes mental health diagnoses, various stressors that preceded the dysphoria, and an overall worsening of psychosocial functioning in parent-child relationship after coming out as transgender. So there's been a lot of mixed responses to this study, both within the scientific community and outside of the scientific community. Got a lot of media attention, but some people are criticizing this study for the methodology that it uses and the interpretations that it makes. Again, Zucker concludes that more research needs to be done on rapid onset gender dysphoria and what its implications could have for clinicians. So the final category that he goes over are best practices for clinical care for adolescents who may have rapid onset gender dysphoria. So there's been one study done by Dutch clinicians that developed a therapeutic model of care to initiate care for the transition of early to mid-adolescence. So before 16, they prescribe hormonal medication. At 16, they begin hormonal therapy. And starting at 18, if the patient wishes, they can begin surgical procedures. At any point, the client can stop the treatment. At any point, they can decide that they don't want to continue with the hormonal therapy. They can continue with the hormonal therapy and never get the surgery. So there's a lot of different options within this model of care. So some clinicians argue that the hormonal therapy should begin a lot earlier for some clients, saying that this isn't soon enough to get them the care that they are wanting and needing. Some reported a lot of benefits from using this as their protocol. And Zucker again recognizes the difficulty for clinicians to implement this model of care without more information or research present. And so this was one of my biggest takeaways from Zucker's assessment, was that in a lot of ways we need more research conducted on gender dysphoria and its implications for clinicians. So I'm hopeful for both the research that has been done and that more research can continue to be conducted on gender dysphoria and its implications.